Hi, this is Dr. Rajput. We are going to discuss about interdisciplinary uh, team for the breast cancer. If somebody has a breast cancer, uh, they have to make sure they get the dedicated and compassionate team. And this interdisciplinary means that the peoples of different professions they combine together and increase the quality of service and save time, and the output is great. And that is very important in case of breast cancer, because the diagnosis has to be made in short time, and the treatment should be appropriate, and in that way a life can be saved. So if somebody has a breast cancer or somebody notices a lump and is in a productive age in between uh, uh, 25 to 40, and if there is no menstrual period, because you have to wait for 1 week, because the hormonal surge can cause the cystic uh, bumps and lumps in the breast. So you wait for 1 week, and then you proceed if they still persist. So the first step is that you should have an excellent diagnostic center associated with those professionals who are, if not in the under the one roof, but they work so closely that you don't lose any time uh, period. So the diagnostic is the first step, in which uh, you should have an excellent ultrasound. You should have 2D mammogram, and if 3D, it's a better, which is called the uh, tomosynthesis, and MRI for the dense breast and calcification, and MRI plus PET scan for the distance metastasis. Once you have the diagnosis, the other professional you need is the interventional radiologist, who does the different type of biopsy. I cannot emphasize on this point much enough that you need an expert interventional radiologist who can have enough specimen, because the diagnosis is made on the tissue that the interventional radiologist has obtained. And if it's not enough, then the diagnosis cannot be made. And nowadays, there is no excuse that not enough sample by the pathologist. So please make sure that the interventional radiologists know the core biopsy and also the different core biopsy by ultrasound or stereotactic, or even much better with vacuum assisted biopsy. And then the other professional for this team is the pathologist, who is the unseen hero of this breast cancer, who is behind the scene and who makes the definite diagnosis for your specimen. He does the histopathology, immunology, genomics, electron microscopy, and the cancer markers. And he gives the definite diagnosis for the other professionals. Your next step is that you should have a surgeon who has been doing the breast surgery very regularly, And of course, he should have association or on the team there should be a plastic surgeon in case if you need the reconstructive surgery after the mastectomy. And sure enough, after that, you need an associated oncologist, radiologist who can give you the radiation treatment, and they should be well versed what they can give intraoperative at the same time post-operatively. And then comes the medical oncologist who should give you the chemotherapy and should be also agreeable to give you the new target therapy and monoclonal antibodies, as well as he can refer you to the research trial center. During and after, there are ancillary services which I cannot emphasize enough as well, that they play a big role, such as the chemotherapy nurse, social worker who can handle your financial account, because a lot of time the insurance companies give very hard time, and they can smooth out the problem. Also the nutritionist on your side during those period when you will have a nutritional imbalance. Also the different prosthetic people for your breast implant, and also for the hair loss. And so all these members, they are required to work together, and your best bet would be to go to the breast center where they all work as a team, and it will save you time and it will save your life. And I hope if one of those points you stick to it, you will be you will benefit very much from this information. Thank you so much for listening.